This is a walkthrough video of the health energy assessment of the health facility, with a focus on the energy assessment aspect. The health energy assessment helps one understand and map the health and energy infrastructure needs and gaps of the facility, which will further be utilized for designing appropriate clean energy solutions for the same. This video provides step-by-step guidance on how to do an energy assessment of a primary healthcare facility. Before we get started, it is important for the auditor, surveyor to make sure that she are carrying the following tools with them: print of a survey questionnaire, stationery, pen, pencil, notebook, mobile phone with a camera, permission letter from the authorities, mask sanitizer, clamp meter. If available, clamp meter is the device used to measure the voltage, current, surge of the equipment. Please click the wide-angle picture of the facility. It would help in getting the sense of the surrounding of the building, fencing from the protection perspective, trees and shadow-free area, any other facilities such as open well, generators, etc., and also for future identification purposes. After taking the picture, please make sure to note the GPS coordinates of the location. Once you enter the health center, and the greetings are done with the health center point of contact, please show the permission letter to the point of contact. Please explain the purpose of the assessment and the activities associated with it. Saying the assessment begins. The next step is to conduct the health assessment. To do this, please fill the health infrastructure aspects of the form taking the inputs from the health center staff, as mentioned in the form. Now, let's look at the energy assessment aspect in detail. Energy assessment begins with an understanding of the overall layout of the center. Please develop a quick map of the center, as shown here. It is always advisable to start from the entry of the health center to the end so that no room, space is missed while auditing. Also, please note down the south direction of the building. If the layout is already present in the center, please request for a copy. If there are multiple blocks, please mention them in the load details and a separate layout of each block is required. And also distance between each block is to be mentioned. Once the layout is completed, please visit each and every room to conduct the in-depth energy assessment. The most important spaces to be covered are the labor room, doctor's room, operation theater, labs, wards, corridor, cold chain, toilets, and pharmacy. For energy assessment, in each room, note the number of fans and lights and in the form that is shown here. Please note down all the equipment in the room on the same sheet. If the clamp meter is available, then take the voltage current measurement of each equipment and note it down on the same sheet. If not, then please take the photo of the label on the device, as shown, to record the make and model of the equipment. Once you are done with the energy audit part, we will now move on to the solar battery storage space. Please check out the space in the facility available for battery storage and take a photo of the same. Battery inverter storage space should be a well-ventilated area away from water spillage. If the solar system is already installed in the facility, please check if it is working properly or not, their capacities, and also which loads are connected to solar. If the health center has monthly data updated on their walls as shown in the picture, please take a picture of all such data points and make a note of that. Please ask the health facility staff to share the electricity bills details. Take a photo of the same as shown. Also, if they are using any alternative energy source like diesel generator, as a power backup, please ask for the bills for the same. Take a photo and make a note of the same. If some health facilities don't have such an energy bill, please ask the average amount paid by the center monthly and make a note of it. Please check out the space available on the roof to install solar panels. Please see if the roof has shadow-free area and enough space for installing the solar panels. Post-assessment. Please share the following details with respective authorities. Debrief the healthcare center staff on the next steps acknowledging their support. Please share the details with the concerned organization to design the solar systems for the facility. The layout of the facility. Load details. Contact of the person in charge of the center and local, in-house electrician and maintenance person of the center. Photographs, named room-wise. Roof photo, Equipment. Health data plus filled assessment form